Alright, so in labor we actually have different stages. Okay, now for each of the stages we have things that you should do to make sure that the stage usually goes on very safe. Now for the second stage of labor, and this is the different characteristics of the second stage of labor. You can pause to observe it. Okay, but I just wanted to show you that the second stage of labor is when the baby's head has crown and the baby's delivery. Third stage of labor is after the baby's delivery, so delivery of the placenta. Okay, that's just a summary. So how can you manage this second stage of labor and make sure that everything is going on really safe? Okay, so second stage of labor begins when the cervix is fully dilated and it ends with the birth of the baby. Managing this stage is very important for safe and a smooth delivery. Okay, of course it will be of advantage to the mother and the baby. So key phases of the second stage is what we have: the passive phase. The cervix is fully dilated, no strong urge to push it. Fetal head continues to descend naturally. Now the active phase, we say that there is maternal urge to push. Fetal head becomes visible. The baby's head crown. Okay, crowning of the head, you can see it there. So it ends with complete delivery of the baby. That's the active phase, right? So management principles is, through this stage you should continue monitoring the baby's heart, continue monitoring the mother's vitals, continue making sure that the mother's position is what optimal, is nice, because some women the pain has literally made them almost crazed up, so you have to ensure that even as much as she's not in a conscious state, everything is nice for her. The pushing techniques allow spontaneous pushing if effective. There's sometimes you can be cheering the woman up. Yes, push. Do you understand? Okay, so some of those things, they help to make the stage go on safely. So pain relief, sometimes the pain is too much, you can just give epidural anesthesia. Then make sure that you are talking nice to the mother all this while. Okay, perineal support, that one is gentle delivery of the head just to prevent tears. So delivery sequence is the head has to come out first, followed by the shoulders, then next the trunk. Okay, so avoid any forceful delivery. Okay, make sure that every phase, just take it phase by phase, every phase is going on safely. So make sure that everything around that place is very neat. Aseptic preparation. Okay, clean everything there so that the mother doesn't have infections during the process. Document everything you are saying during that time. Time of this occurring, time of this occurring, time of this occurring. Okay, so that's what we have for the second stage of labor and the various ways in which you can actually manage it.